About 37 million Americans suffer from sinusitis every year. As you can see, it is a very common health condition, especially here in our community and in the Tennessee Valley area. Balloon sinus treatment can often relieve this condition. It is a minimally invasive procedure that can be done under local anesthesia here in our office. Of course, it can also be done under general anesthesia, such as in children or even adults who choose to have it done in a hospital setting. Following the procedure, patients usually resume normal activities in a day or so.
My entire life I've suffered from severe sinus infections, and my quality of life was terrible. I was suffering from probably 4 to 6 sinus infections a year.
I did not want to have surgery, which the downtime, we all know about that. From work, recovery.
Overly surprised at about how easy it was. We did it in the office. It took about an hour. It was completely painless, and I probably could have gone to work the same day.
What it's done is the infections, the pressure, the headaches, all those symptoms have gone.
Quality of life has just skyrocketed. I mean, the biggest thing that I've noticed is I'm sleeping a whole lot better. My wife tells me I don't snore as much, which is a plus for both of us. And just being able to breathe is a huge relief for me.
Balloon sinuplasty involves 3 separate instruments. First, we have the sinus guide catheter. Then we use the lighted guide wire, which you can see at the very tip. And finally, we also have the balloon. As I'm pushing it through, you can see it come out. And that is what is dilated with this device to enlarge the blocked sinus ostium. A camera, as you can see here, and the endoscope are used for enhanced visualization and magnification. Let me show you some pictures taken in the operating room while doing balloon sinuplasty. Here we see the left ethmoid bulla, or the left ethmoid sinus, and as well the opening into the left cheek sinus. Now, the sinus catheter is gently advanced towards the region of the left frontal sinus. It is moved up ever so slowly, and once we feel that we are in the correct position, a guide wire with a light at the very tip is passed through the catheter. Once that lighted guide wire is in the left frontal sinus, we can see light overlying the forehead, confirming successful navigation. Then the balloon catheter is passed over the guide wire, aiming towards the left frontal sinus, which we have already entered with the guide wire. The balloon is then inflated within the frontal ostium and held for 5 to 10 seconds. The balloon is then deflated and the entire apparatus removed gently. Look at the final result. This is the left frontal ostium, dilated, smooth borders without any mucosal tears, which could cause obstruction again in future.
If you would like to make an appointment with Dr. Nita, call 256-882-0165 at your convenience. New patients are always welcome.